If you're considering cataract surgery or have already had it, then this video is right for you. Cataract surgery is a great procedure, but it's not always perfect. Today, we're going to outline the 5 biggest regrets that patients have and what you can do to avoid them. So let's dive in. Regret number 1, not considering other treatment options. Cataract surgery is often seen as a go-to solution once you have cataracts. However, many patients who undergo cataract surgery sometimes regret not exploring other treatment options. Depending on the size of the cataract and how much visual impairment it's causing, sometimes changing your prescription for your glasses or contact lenses may help you regain some vision to gain functionality. If your cataracts aren't significantly affecting your daily life yet, then exploring some non-surgical options first might be right. Cataracts typically progress slowly. In some instances, trying non-surgical options first may be the next best step. Regret number 2, not asking enough questions before the surgery. Cataract surgery is routine, but it is still surgery. There are risks that apply during cataract surgery, and talking to your surgeon about these risks is extremely important. The surgeon should be able to explain the risks, the benefits, and the alternatives, along with what to expect before the surgery, during the surgery, and after the surgery. Some people regret not fully understanding exactly what the procedure entails, so make sure you talk to your surgeon about the risks, benefits, and alternatives of the surgery and what to expect before, during, and after the surgery, and discuss your specific lifestyle and what sort of visual outcomes you're looking for after the surgery, because that'll help determine the lens choice that you're going to go with. And that brings us to regret number 3, which is not understanding the expected visual outcomes after the surgery. Cataract surgery can work wonders, but it is important to set realistic expectations with patients. Many patients go into cataract surgery expecting perfect 20/20 vision, and that can sometimes happen, but it all depends on the patient's specific set of eyes, the type of lens that the patient is opting for, and whether the eye otherwise is healthy. For example, many patients expect that after the surgery that they're never going to need to wear glasses again. Well, that depends on the type of lens choice. There are lenses out there that can give you a range of vision, allowing you to see from close to far. Now, those lenses are typically not covered by insurance, so some patients will pay out of pocket for them while others won't. In most patients, they're opting for a monofocal lens, which is covered by insurance, that gives you vision at one distance. And most patients opt for distance vision. In those patients where they get a monofocal lens in both eyes, they're able to see clearly in the distance, but they typically need something for up close. Moreover, if patients have astigmatism and that astigmatism is not corrected, they're probably going to need a prescription full time to be able to see far away and up close. So before going to surgery, it is very important to have a clear conversation with the surgeon. You can explicitly ask them, if I pick this lens, what kind of vision can I expect? Having that conversation beforehand will prevent and avoid any surprises after the surgery. Regret number 4, the potential onset of dry eyes after the cataract surgery. We've seen in recent literature that the onset of dry eyes after cataract surgery not only decreases patient satisfaction, but also decreases visual outcomes. And eye surgeons as a community have really come to understand the impact of dry eyes on the pre-surgical and the post-surgical patient. In many patients, when the dry eyes develops after the cataract surgery, they'll often complain of symptoms like irritation, dryness, redness, even blurry vision many months after the cataract surgery. And so it's important that if you are concerned about dry eyes or whether you already have dry eyes beforehand, to speak to the surgeon about it. Alert your surgeon that either you've been struggling with dry eye symptoms or you've been diagnosed with dry eye disease, and it's important to control the dry eyes before and after the cataract surgery. And finally, regret number 5, underestimating the amount of eye drops and the follow-up appointments that are required after the cataract surgery. Now, I tell patients that while cataract surgery is safe and effective, it's still surgery. We are operating inside the eye. And so it's really important to follow the pre-operative and the post-operative instructions. And that often includes a series of eye drops that you're going to take for a few weeks, along with multiple appointments. Both of these things are very important. We want the eye to heal very nicely and successfully so that we can get an idea of what the visual outcome is. And for that, having regular follow-up with your surgeon, along with taking the eye drops as prescribed, is critical. Now, that being said, using the eye drops multiple times a day can be very cumbersome for patients. For some of my patients, they just set phone reminders that reminds them to take the eye drops at set intervals throughout the day, and I find that that works pretty well. So there you have it, the 5 biggest regrets of cataract surgery. Cataract surgery is a wonderful procedure. However, it is still surgery. When you meet the surgeon for the cataract consultation, come with a list of questions and make sure they answer you appropriately with the right preparation, and expectations, you can expect to have a good visual outcome. My name is Dr. Jovi Boparai. I'm an eye surgeon by training, and I love sharing information with patients so that they feel empowered. If you've had cataract surgery or are considering it, leave your thoughts in the comments below and I'll definitely get back to you. In addition, check out these videos down here that may answer other questions for you. Take care of your eyes and we'll see you next time.